The FedLife podcast is presented by Serving Those Who Serve, a fiduciary, fee-based financial planning firm serving federal government employees and retirees all over the country. This podcast is for informational purposes only and is not intended to be taken as financial advice. All listeners should consult their personal advisors before taking any action. The opinions expressed by our hosts are their own and do not reflect the views, policies, or position of Raymond James. Securities are offered through Raymond James Financial Services, Inc., member FINRA SIPC. Investment advisory services are offered through Raymond James Financial Services Advisors, Inc. Serving Those Who Serve is not a registered broker-dealer and is independent of Raymond James Financial Services, Inc. And now, here are your hosts. Dan Sipe serves as a branch manager for Raymond James Financial Services and Serving Those Who Serve. Ed Zerndorfer is our guest and federal benefits expert in the space.
Hello and welcome everyone to this episode of the FedLife podcast. I'm your host, Dan Sipe. Additionally, I'm the branch manager here at Serving Those Who Serve and Lee Sipe and Associates. I want to begin, as I always do, by saying thank you. Thank you for taking time to listen, but also thank you for your service to the government, to the country, to me, to everyone. You do not hear that enough, but you will always hear it here. The other thing you're always going to hear on FedLife is my buddy Ed Zerndorfer. The guru is back with us once again as part of our ongoing mission to reach, teach, and serve you, the career civilian feds. Once again, we're following Ed's Fed Zone articles, which you can find every single week in the Fed Zone. That's fed-zone.com. And that gives us one more way to reach and teach. So, Ed, I know these things are supposed to exist outside of time and space, but we are indeed wrapping up another year together. Awesome. Great to have completed another one. And so we're taking care of a couple of odds and ends, and specifically something that's actually got some folks buzzing, which is the recommendation from OPM for FEHB plans to adopt Medicare Part D for federal annuitants. That's a mouthful, and it's a whole lot of stuff for us to talk about. So you wrote a great article on it, as usual. So how about if we start off with a primer for our folks who might not be familiar, and also some history. So for those who don't know, what is Medicare Part D?
Okay, Dan, we're going to start off with a little history. Until the year 2003, there was only two parts to Medicare, called the original Medicare. Medicare Part A, the hospital insurance, and Medicare Part B, the medical insurance. They both started in 1965, and federal retirees, when they turned 65, were encouraged to sign up for both Medicare Part A and Medicare Part B. They didn't have to. Medicare Part A was sort of a no-brainer because it's free. The premiums were prepaid. But Medicare Part B, on the other hand, the medical insurance, was a little bit of a challenge because it's not free. The question came up, why do I need to sign up for Medicare Part B when I have my federal employee health insurance retirement? We're not going to cover that right now. But the Medicare Modernization Act of 2003 created Medicare Advantage plans, also known as Medicare Part C, enhanced Medicare HMOs. We're not going to cover that, but also it created Medicare Part D, the prescription drug coverage, and that started back in 2007. Now, why prescription drug coverage? Well, individuals who were enrolled in Medicare Part B, both federal retirees and private individuals, not federal retirees, really did not have any type of good prescription drug coverage when it came to Medicare Part B. They covered certain things, but not much, particularly individuals who were incurring catastrophic prescription drug expenses. We're talking down here, maybe they're paying out of pocket thousands and thousands of dollars. They had specialty drugs. So Congress felt the need to create a part to Medicare that would cover what's called catastrophic prescription drug expenses. Now, starting in 2007, if an individual enrolled in Medicare, they enrolled in Medicare Part A, making him automatically eligible to enroll in Medicare Part B and Part D. If they didn't sign up for Part D when they first signed up for Medicare, and later on they would incur a penalty. This was not the case for federal employees or federal retirees who had their FEHB insurance. Why? Because the FEHB insurance did offer what's called creditable prescription drug coverage. And because of that, a federal retiree was not required to sign up for Medicare Part D. And if they didn't sign up, and later on they did, they would not be penalized. Well, over the years, prescription drugs, as you know, Dan, got more and more expensive. I mean, we're talking about some specialty drugs. We're talking $15,000 a year.
Sure.
So in the year 2022, Congress, under the Inflation Reduction Act, had a mission to control the cost of prescription drugs. And one of the changes they made was to lower what was called the catastrophic prescription drug expense limit starting in 2025. And this year, for example, the catastrophic drug expense limit, it's when Medicare Part D would really kick in, is $8,000. Well, effective January 1st, 2025, next month, it goes to $2,000 catastrophic coverage, which makes Medicare Part D a little more attractive for federal retirees, to the extent that OPM is encouraging the Federal Employee Health Benefits insurance companies to adopt Medicare Part D as part of their program. And this started really last year, 2023. What happened was that several FEHB companies adopted Medicare Part D coverage, and they automatically enrolled those individuals who enrolled in their FEHB, in their insurance. They were automatically enrolled in Medicare Part D. And they sent out a notice. It was during last open season, that if you don't want to enroll in Medicare Part D, it was called a prescription drug plan. It's a Medicare Part D plan, PDP for short. You have the option of disenrolling, and you'll get your regular FEHB prescription drug coverage to your insurance company. Okay. And many individuals did not note there was a 30-day deadline to get out of that PDP.
Sure.
That's a different story. Well, let's turn the clock up to right now, to 2020. We are in the open season for 2025. There are 20 FEHB companies that have now adopted a PDP, and they automatically enrolled those retirees who enrolled in those plans to be automatically covered by that PDP. Now the question is, does an annuitant who's enrolled in this PDP really want to be in there? They do have the option of getting out. Here's the problem, Dan. OPM didn't give it any guidance. They just said, here it is. Okay, you'll hear from your FEA, your company, when you have the option of getting out. So what's the criteria for me to stay in this PDP, or just get out of it and keep my regular prescription drug coverage I have for my FEHB plan? You're talking to someone who is an FEHB plan. I'm a federal retiree. My wife and I are under, I'll give you the name of the company. That's one of the 20 companies, GH Standard. And yes, we got the letter saying, do you want to stay in the plan or not? You have 30 days to get out. Now, keep one fact in mind, Dan. This is very important. You cannot be both covered by your prescription drug plan in a health plan. In my case, GH Standard, and be in the PDP. You can't have both. You have either one or the other. That's why they say giving you 30 days to get out. So the question comes up, what is my criteria? What is my criteria for not being enrolled in the PDP? And this is what I went through in my column. The problem is that most annuitants don't know how Medicare Part D works. The whole idea. Medicare Part D works, and this includes the PD plan. There are certain prescription drugs that are part of what are called the formulary. Each PD plan has a formulary. The drugs the prescription drugs they will pay for, but they don't pay 100%. You have a deductible you have to reach before the plan's before your PDP is going to play. What is that deductible? $590. Then you get into what's called your initial coverage, in which the PDP plan will pay 75% of the prescription drug expense. The enrollee pays 25%. And then once you reach $2,000 out of pocket, the PDP plan pays 100%.
Gotcha.
Okay. That's the whole idea. So I'm getting questions, and we covered this during our monthly FEHB and Medicare webinar. We have it every month. What should be my criteria? Okay. If I'm a federal annuitant, I'm trying to decide, now, should I stay in this Medicare Part D plan or should I get out of it? Here's what you got to ask yourself. Am I going to be fully covered for my prescription drug expenses? Or right now, what do I have in terms of prescription drug expenses? If you let's say you have a spouse who's part of your FEHB coverage, are your prescription drug expenses currently being covered by your FEHB plan? If the answer is yes, and you're paying, you anticipate paying next year in 2025 less than $590 in prescription, you're going to have out-of-pocket expenses less than $500. You're not a candidate for the PDP. You have sufficient coverage with your PDP plan. My wife and I we're blessed with good health. Our prescription drug expenses may be at the most $200 to $300 a year. So we contacted GJ Standard, get us out of there. We don't need it. We're perfectly covered. We're perfectly happy with our coverage. We're satisfied.
Sure.
But let's say you're on the borderline. I get this question. I'm getting questions galore about this. What do I do? I said, the first step is call the company. You got a letter. You're getting a letter from your FEHB company. You got that 30-day letter. And they're going to explain who your PDP is with. Like, for example, GHA with a company called SilverScripts. And you have to call them and ask them, well, what are the prescription drugs in the formulary? Here's my prescription drug coverage. Here's what I'm taking. Here's what my spouse is taking. Do you cover those drugs? Because the answer is no, it's a waste of money. If they do cover it, how much will they cover? It's a numbers game, Dan.
Sure. Gotcha. Now, the other thing that you always build into these articles, Ed, and our feds are so lucky, is you put together some great tables that help people track this and understand it. So, folks, seriously, no joke. Even though you're listening, this is great. We want to make sure we reach you this way. Head over to the FedZone, fed-zone.com, and check out Ed's article, because this chart, you cover the deductible stage, the initial coverage stage, and the catastrophic coverage. So why don't you just do a little flyover on that to sort of prepare folks what they'll be seeing when they see your chart.
All right, I'm looking at the chart right now, Dan. And as you said, there are four stages here, 3 stages. 3 stages. The first stage is called deductible stage, and I have $590. By the way, a beneficiary, that's someone who's enrolled in a Medicare Part D plan, is responsible for 100% of his or her prescription drug costs until this deductible is met. The Part D prescription drug plan can have an annual deductible of no more than $500. It may be less, but it cannot be more. No more. Some drug plans carry a $0 deductible. You won't have to pay anything then. In some drug plans, the deductible may not apply to certain low-cost or generic drugs. Dan, this is why the person has to contact the prescription drug, or the company, in my case, SilverScripts.
Sure.
Okay? Then we get to what's called the initial coverage, starting at $591 to $2,000.
Yep.
A beneficiary pays up to 25% of the coinsurance for medication covered by the beneficiary's, and this is the key word here, Dan, formulary. What are the prescription drugs that the beneficiary is enrolled in, is taking? They may not be in the prescription drugs that the person is taking may not be in that plan. in that plan. That's why you have to check. The list of the plan, this is called, the formulary again is called, it's a list of the plan's covered medications. If your medication is not in the formulary, it's a waste of money.
Gotcha.
You'll be paying 100% then. The beneficiary's maximum out-of-pocket cost will be $2,000. Once the beneficiary reaches $2,000 for the beneficiary and the beneficiary spouse, the combined $2,000, at that point, they've reached what's called the catastrophic coverage, in which the beneficiary has all medications in the formulary at this point will be covered 100%. The prescription drug plan will pay 100% for the prescription drug costs at that point, once you reach $2,000. And this is what I was referring to earlier, Dan. This is why Medicare Part D may be more attractive this year, starting January 1st, 2025, than it has in the past. Currently, 2024, that catastrophic limit is $8,000. God willing, that no one's going to have that type of cost, but it's possible someone's going to have a maximum $2,000 out of pocket. That's why it may be more attractive. But a federal retiree has to do his or her homework. This is not for everybody's situation is different, and you got to make that decision within 30 days.
Gotcha. And your article goes on. You make a pretty good list of 8 things that any annuitant enrolled in Part D would need to know. Why don't we talk about those a little bit? Why don't you walk us through those?
All right. I have a list. I have eight suggestions.
Mm-hmm.
Number 1, a federal retiree should contact his or her FEHB plan and find out more about the plan's prescription drug plan associated that they're in. This is called the PDP, the prescription drug plan. Number 2, it's always to a federal annuitant's advantage to keep their FEHB coverage without any changes. In other words, if they like their FEHB plan, they're totally satisfied. There's no reason to change it. But they have to look at the prescription drug coverage as part of it, as part of the plan. If the prescription drug coverage is no good, then maybe it may be worth getting into the PDP. But, Dan, as we always say, one thing, the 11th commandment, don't ever drop your FEHB plan because the prescription drug coverage is lousy. You don't do that. You always keep your FEHB plan. Keep in mind that if worse comes to worse and you don't like your FEHB drug coverage and you don't like the PDP, you can, without penalty, enroll in Medicare Part D. Medicare Part D. That's the prescription drug. That is the prescription drug program. That's for everybody. But you probably have to do it. You have to be pretty quick because right now is the current open season. It ends on December 7th. So we have to be quick about this because you have to do it. And then if it turns out you don't like Medicare, you don't like the Medicare Part D set the private plan, you just get out of it. You get out of it next year and you continue with what you have. Okay. Number 3. And this is what I just mentioned. A federal annuitant cannot drop only their FEHB health plan coverage. You can't say, well, take me, just get this. I'll stay in the FEHB plan, but I'm not going to be covered by your, just take me out of the plan's prescription drug coverage. Would you reduce my premiums? No, they're not going to do that. They're not going to do that. Again, you don't want to drop your FEHB plan. Yeah, you could suspend it. Which means you go into what's called Medicare Advantage. Right now, it's the current open season for Medicare Advantage. All Medicare Advantage plans also have prescription drug coverage through the Medicare Part D. You may want to look into that. But again, you have a deadline of December 7th. The FEHB open season ends on December the 9th. What's called the annual enrollment period for Medicare Advantage and Medicare Part D ends on Saturday, December 7th. So we got to be quick here. I don't know if people will be listening to this after the fact, but anybody listening now who's going to be listening to me within the next few days, you have a deadline of December 7th. Okay. Number 4, A federal annuitant who is incurring significant annual out-of-pocket prescription drug expenses must check with their FEHB plan and find out how much coverage the FEHB program plan offers in prescription drug expenses. Find out what the plan has to offer. They have to call their plan. I have this and this is drug. Okay. For example, ourselves, GH Standard. The prescription drug coverage that we have is handled through Caremark. They're the ones, that's CVS Caremark. If we had, God forbid, a lot of prescription drug expenses, we'd have to contact Caremark to find out what they offer in prescription drug expenses, prescription drug coverage. Okay? The annuitant must be specific with the particular prescription drug information and for their spouse, if applicable, who is also in need of prescription drug coverage. If the FEHB program plus prescription offers a sufficient amount of prescription drug coverage to the extent, and this is important, Dan, to the extent that any out-of-pocket prescription drug expenses total less than $500, stay with your plan. Stay with the FEHB plan prescription drug coverage. Again, the big number, $590. That's it. If you pay out-of-pocket less, you expect to pay less than $500, you stay in that plan. You stay in that plan. You stay with your FEHB plan. Okay? And don't enroll in the FEHB plan prescription drug plan. You have to get out of there within 30 days. You have to formally say, I don't want it. I don't. That's what we did. We don't want it. Okay, so that's number 4. Number 5. Now we get into what they call the gray zone. If the annuitant's expected annual out-of-pocket expenses using the FEHB program drug coverage, if they're in their FEHB plan's prescription drug plan, and they expect to spend out of pocket $1,500 to $2,000. We're in the gray zone here. We're more than $590, but we're less than $2,000. Then, in my opinion, it may make sense for the annuitant to enroll in the health plan's Part D prescription drug plan. But that depends, again, in part, which prescription drugs the annuitant is using and how much the Part D drug plan pays for that particular drug. That's why you have to contact the PDP plan directly. In our example, with GEHA Standard, it's SilverScripts. You have to call them. You have to run the numbers. I know it's not going to be easy. It may take a lot of work, but we're talking about big dollars here. Number 6, if the annuitant joins the FEHB program health prescription drug plan, the annuitant will have no prescription coverage through the FEHB program. In other words, you're enrolled in an FEHB plan. You have hospital coverage, you got medical coverage through the plan, but no prescription drug coverage if you join the plan's PDP. Number 7, a federal annuitant enrolled in FEHB plan health in the PDP plan may be subject to an IRMA, an income-related monthly adjustment amount. IRMAs are normally deducted from a monthly Social Security benefit check or paid directly to Medicare. The 2023 IRMAs for high-income Medicare Part D beneficiaries, I have a table. They're not much, but we're talking about anywhere from $14 up to $86, but that's added also to your IRMA. You got a IRMA for Medicare Part B, Medicare Part D. It's the same income tiers. So it all adds up. And number 8, I cannot emphasize enough. Annuitants got to do their homework. They got to know. And if they feel that they're overwhelmed, again, I suggest that they get some assistance, maybe from Medicare. Like I'm going to make a push. I always do this. We give this FEHB and Medicare webinar every month. Dan, as you know, we get lots of questions. We have lots of participation. I think last time we did that. We did this webinar in November. We had, I think, almost 100 people, and it was 127 people. And we had almost 100 questions.
Absolutely.
But we're here afterwards also. We talked about you can have a follow-up meeting. Ladies and gentlemen, we're here to help. We're here to help. This is not easy. This is a big challenge.
Yep. And also, folks, Ed gives a really clear chart. Again, I head over to FedZone covering those IRMA brackets. Now, Ed, you round out the article with 4 key takeaways. So walk our folks through those.
Okay, let me get to the full details. Yes, sir.
And while you go into that, folks, here's the thing. I know everybody thinks about this like 2 months out of the year, but Ed's right. We are doing it every single month. I had to chuckle, Ed. You know, we have our Facebook notifications going out, letting people know, and you wouldn't believe how many people were responding to us saying, why didn't you do one before the end of open season? And my answer to that is, you're right. We didn't do one. We did 11. So folks, tell your friends about this, because if they're just finding out about then, they're going to find out about December or January and say, that doesn't make any sense because it's after open season. No, a lot of this stuff is evergreen. So if you get to this after open season, you're laying the groundwork for next year. You are never hurting yourself by getting this information and working to understand it. So I digress, Ed. Tell us about those key takeaways.
Yeah, I just want to repeat what you mentioned. Please go to that column. It's entitled, OPM encourages FEHB health plans to adopt Medicare Part D for federal annuitants. The article came out at the end of November. I think it's November 22nd or 23rd. It came out. Please, it's there for your reading. Go over it. Read it 3, 4 times. You'll get the information there. I cannot emphasize enough how important it is. All right. So, Dan, here are the 4 things. Unfortunately, OPM has provided little guidance for federal annuitants. Okay. The 20 FEHB program plans offering a Medicare Part D prescription drug plan are supposed to provide guidance. Okay. And I went onto the GEHA website, and it's sort of overwhelming, but the guidance, it's not easy to understand. Okay. So use that as a starting point. Number 2, don't forget, high-income federal annuitants who enroll in a Medicare Part D plan will likely be subject to IRMA. Just don't get that. The improved prescription drug plans were supposed, but by enrolling in a prescription drug plan, the improved prescription drug benefit will supposedly offset the effect of IRMA. Okay, you're getting much better prescription drug coverage than you had before. So the IRMA you're paying will be offset by the reduction in what you're paying for prescription drugs. Number 3, those annuitants enrolled in FEHB health plan and who use prescription drug discount cards from drug manufacturers will lose access to those drug manufacturers, that the drug manufacturers discount program, if they enroll in a PDP. They're going to lose those discounts. So that should be taken into effect in terms of overall savings. Number 4, those annuitants who spend time overseas. This is important. That if you spend a lot of time overseas, they're advised not to enroll in Part D because it's a waste. There's no coverage. If you need prescription drugs overseas, the Medicare Part D is going to not do you any good. Likewise, if you're overseas and you're enrolled in Medicare Part B, you get sick, God forbid, you get in an accident, there's no Medicare coverage. Okay. But that does not mean you shouldn't sign up for Medicare Part B because you're going to come back to the States. You have to come back to the States. That's where you need Medicare Part B. I also suggest, and this has it's related to Medicare Part B and the FEHB plan, that if you do a lot of traveling overseas, I highly suggest that you buy separate travel medical insurance. We have it. We travel overseas, wife and I, and we got it from AAA medical insurance. It's not that expensive, but like all insurances, it gives you peace of mind, just in case.
Indeed. Ed, just another exceptional article. It's so awesome, the work that you're always doing to make sure feds have the data they need to make good decisions. So you really nailed it on this one yet again. It's never a surprise when you come up with a great article. So as I always say, on behalf of all our feds and on behalf of Serving Those Who Serve, thank you for being such a great resource.
My pleasure.
You are really helping people. Well, folks, that's a wrap. We are Serving Those Who Serve. Be sure to subscribe to this podcast on our YouTube channel and also Spotify. And please, please, please remember to share it with friends, strangers, throw in a couple enemies. It's the holiday season. You'll make some friends that way. And don't forget those live webinars that Ed's talking about pretty much every single week. Just head over to swserve.com. You will see the blue button, hover over it, turns red. Click on it. It's going to take you to the landing page. You can pick from the whole array. The guru will come to you, reach you where you are, teach you where you are, serve you where you are. Sign up for one, sign up for all, and share that with your friends too. I guarantee you they will thank you. Be sure to read Ed every single week in the Fed Zone. That's fed-zone.com. And above all, and I know I'm breaking the rules here, have a safe and healthy holiday season. For Ed, the crew at Serving Those Who Serve, and me, Dan Sipe, I will close as I always do by saying good luck, Godspeed, and above all, remember, it's your Fed life. Make it a great one because you deserve it. Stay well, everybody. We are out.